Welcome to the CRM Show. Today we are joined by Dr. Karthik Anantharaman, a distinguished physician turned global healthcare leader with over 25 years of experience across hospitals, pharma, diagnostics, digital health, and medical devices. He currently serves as the Vice President, International Sales and Marketing at Apollo Hospitals, leading global markets, digital strategy, CRM, and international patient services across Asia, Europe, the Middle East, Africa, and Latin America. Dr. Karthik has previously held various senior leadership roles, including COO at Roche Pharma and Diagnostics, Director at MedLife, Business Unit Head at Biocon, and many other key leadership positions. I'm super excited to welcome him to this episode of the CRM Show. Karthik, it's wonderful to have you on the CRM show. Thank you so much for joining me here for the 7th episode. I felt very happy is that you took the effort to get a traditional attire for the show. We all take the effort to do a show. But what really gives us the happiness and joy is when the guest comes and says the experience was really great. And more than that, you made it more happier for us because you took that extra effort to ensure you're in traditional attire here. I really, really appreciate it. Thank you so much.
Thanks for having me, and possibly this is the first time I'm giving an interview or a talk show in a traditional attire.
Okay.
And I truly love that idea, and I really didn't want to miss that chance, and I think that effort is worth it.
Wonderful to see you also. I think it goes really well with our set design as well.
Wonderful, yes.
So first thing I want to ask you is, you've worn multiple hats across your career, right? More than 2 decades of your career graph. You've been started off as a doctor, then you've been a marketer, COO, sales strategist. Globally today, you're handling international sales for Apollo. So multiple hats I can see. Talk to me about these various roles that you've taken up, because that's not really conventional for a doctor to venture into the business side of healthcare. Most of the doctors to start up their own practice or join a very reputed hospital. But this line of career that you have taken up is very different and very exciting for me to know. So talk to me about that.
I'm glad to know that you're still saying it's different. Because when I started, it was actually quite out of the world. At least in my peer group, nobody chose the path that I chose for myself. A lot of people used to ask, why did you even want to be a doctor if you wanted to be a marketeer?
Okay.
So to me, in my life, all of this happened by chance.
Okay.
So I chose to be a doctor to choose a certain career, but there were certain policy level, mandates that were there at that time where I could not pursue what I actually set out to pursue. And hence I kind of took a pause, thought for myself that can I pursue something different? And hence I thought of pursuing a business management degree after my medicine. And that's how business happened, or that's how the commercial side of healthcare happened to me. And I'm truly grateful for my first employer who taught me everything. So because I come from an absolute non-commercial family. So nobody in my family had an experience of anything to do with sales, marketing, or anything like that. They were all true blue professionals, and hence I think I owe it to my employer, the first employer who really molded me and gave me the exposure or experience that has made me what I am today. Okay. That's how I would put it. Okay. What I really still continue to enjoy in my job is the ability to serve patients, if not directly, indirectly.
Very interesting to know that. And do you miss practicing as a doctor? Because I want to ask you,
Sure.
when most of your peers have taken over that space, do you miss that part, or are you really happy and enjoying the business side of healthcare, and you feel like I wouldn't have enjoyed practice as much as I'm enjoying business right now?
Sure. I actually don't miss, because I feel more I have a sense of larger gratitude.
Okay.
And I possibly have a larger sense of larger satisfaction in what I do, because someone did ask me, like, why did you really want to switch over to the commercial side of things when you could have really been a clinician? So my, I think, short answer to that is that as a clinician, yes, I could positively impact lives of thousands of patients over the years. But with what I do now, I'm able to work closely with thousands of doctors and through them impact lives of millions of patients.
Okay.
So
The scope is larger.
The scope is larger. Yeah.
So you've seen two different spectrums, one in MedLife, one I'll say in Apollo Hospitals. MedLife, to one side, it's a high volume digital platform, and Apollo Hospital is very complex healthcare ecosystem as well. These two different spectrums is how I see it. And when you talk about these two systems, there should also be a different CRM design altogether for implementation. The expectations are going to be different, and the touch points are going to be different. So how was the design made to orchestrate customer journeys and also eventually design sales and CRM for both of these spectrums?
Let me start with the MedLife journey. I think when we began the journey with MedLife, it was envisioned to be a true blue e-pharmacy platform. Now, in an e-pharmacy, typically what one would require is basically a customer servicing that where you would need where a customer, which is basically a patient, would come with a prescription. The prescription should be valid, and typically as per law and norms, any prescription that is written by a registered medical practitioner in the last 6 months is what is considered valid. So they would upload the prescription either as an image or a scanned PDF file or something onto the app or a web-based app, and then it goes to the dashboard, which is a CRM dashboard that MedLife used to have. That dashboard used to be handled by a group of pharmacists. Now, the pharmacists need to read the prescription. It needs to be legible. If it's not legible, they will ask the patient back to re-upload a legible prescription. And then they need to service that prescription. Many a times we used to find that the prescription that was uploaded was either not legible or was not valid, where we took that extra effort to have a set of doctors who could offer a last mile consultation to validate the signs, symptoms or medical concern that the patient had, and then we could generate a new valid prescription if that was the need of the patient. So that you didn't have to ask the patient to go back to their doctor, get another prescription and then revalidate the prescription, which is more time consuming, not really consumer friendly. And hence we took the route of having doctors on board that could validate, generate a valid prescription and hence make that order serviceable. What we realized is that we were only serving one part of the patient journey. So what were we missing? So if we for once put ourselves in the shoes of a patient who has a medical concern would first visit their family doctor or a healthcare facility. The doctor would first run certain diagnostic tests. The doctor would then do some checks. The doctor would then generate a prescription. The prescription does not have just pharmaceutical prescription written on it. It also has investigations written on it. What we were missing is a facility to service the investigations part of it. We were only trying to service the medicine part of it. The next thing is most of the diseases today, while there are acute diseases which you would treat once and try to cure, most of the diseases today are non-communicable diseases which are chronic diseases. We start with the simplest as diabetes, hypertension, or even high cholesterol or even thyroid disorders. All of these are chronic lifelong disorders which you need to manage. Now, in these conditions, you constantly need to go back to your treating doctor and ask them, what has been your prognosis? How well are you faring? Are the medicines working or are they not? So they were missing the consultation part of it as well. So what we did to integrate the patient journey is what started as a pharmaceutical e-pharmacy platform also got integrated with an e-lab platform and an e-consultation platform. So you could add all of these into a cart and then check out, which earlier was not the case, where pharmacy had a separate cart and a checkout, lab had a separate cart and a checkout, and consultation had a separate ordering system where you can schedule online consultation with a doctor of your choice and then make a payment and then go for a e-consultation. So all these three were there. Now, in a way, I should certainly acknowledge that COVID played a huge role in bringing out approved regulations in India, at least, in terms of validating or I would say making teleconsultation a regulated business in itself. And doctors for the very first time were allowed to offer remote consultation over a video call. And they were for the very first time allowed to give a prescription over a video call, which earlier was not the case. This totally, I would say, transformed, in a way, disrupted the entire e-health industry of sorts, where from that MedLife example, to kind of summarize that part, we were able to naturally integrate the entire patient requirement or journey of being able to service their consultation requirement, their pharmaceutical requirement, and their lab requirement all together, including second opinion when required.
Okay.
So that was the cohesive ecosystem that we could build over a period of time.
This was
And
before we have all the apps today.
Correct.
It was before the...
Correct.
Oh, okay.
This
It was way ahead of its time.
at least about 6-7 years ago from today, right?
Okay.
First of its kind, but I think everyone, all the e-pharmacy apps or businesses that were there at the time quickly realized this potential and they all started evolving in this direction.
Right. Yeah.
And today we see a more evolved version of what it is
Correct.
today.
Yeah. And how does it work?
Coming to the Apollo side.
Yeah.
Apollo has always long been, for more than 4 decades, has been one of the torch bearers of what we typically call high quality healthcare in India, from India for the world, I would say. The Apollo ecosystem was more about compassion, because here we are a part of an ecosystem where you're directly giving, you're delivering service to a patient, right? And at Apollo, naturally, we have this philosophy of what we call tender loving care. Tender loving care typically calls for empathy, compassion, and really doing whatever it takes to ensure that the patient receives the best outcome, clinical outcome for the medical problem that for which they're seeking a solution from Apollo, right? We have multiple examples, multiple anecdotal examples that I can cite where we've really gone beyond what can be done. It's not always about, medical is not always business. Business follows as long as we do the right thing. And I think doing the right thing is about truly demonstrating empathy and truly demonstrating value in what we do. So the Apollo experience has been very unique, very different. So in Apollo, Apollo 24/7 is already a well-established technology platform. And it already has a very well-evolved integration of what I mentioned, of a pharmacy, of a lab platform, and a consultation platform, all into one. And of course, the canvas it provides is, there are 74 hospitals as we speak today, and there are multiple Apollo clinics and Spectra hospitals, which are more community-level hospitals. The consumer today has a choice to pick and choose any doctor of their choice, sitting anywhere in the country, and fix up an appointment at a time of their choice when the doctor is available, when it's mutually convenient. And then avail the consultation, avail the prescription, avail the lab service at the convenience of home or office, avail the pharmaceutical service at the convenience of home or office. So that's the ecosystem that exists today. But all of it is very seamlessly integrated in terms of the journey that you see. It's very seamlessly integrated. What is most important today, which wasn't really the case before, and this is possibly the next era of what we truly call customer relationship management, is I come back to the point of non-communicable diseases, where patients with non-communicable diseases are having chronic conditions like diabetes, which can only be controlled. So you'll have to be in touch with them for long periods of time to ensure that they have their sugar under control. You have to be in touch with a high cholesterol patient or a high blood pressure patient to ensure that their disease condition or medical condition is in control over long periods of time. To be able to do that, the patient needs to come back for regular follow-up to their doctors.
Correct. Yeah.
Right? And the patient should not, for any reason, skip their medicines.
Correct.
So what we have now built is a small data science into how we do it. So we exactly know the date that the prescription gets generated and the medicine gets delivered. Generally, patients prefer to buy stock of 1 month or 2 months or maximum 3 months of medication. We exactly know from our predictive algorithm when that medicine inventory is going to be exhausted, over, and then we give them a reminder call to replenish their stock of medicine.
Right.
Since we are generating the prescriptions, we exactly know when is the doctor who gave the consultation has asked this patient to come back for a follow-up visit, or has asked them to repeat a PET CT or repeat an ultrasound or repeat an X-ray or any investigation which helps the doctor to give them a data-backed advice on what their next step needs to be. So what the team does, it is already plugged on the dashboard. This patient is due for X-ray on this day. This patient is due for the next consultation on this day. So they give a call back. The CRM team gives a call back, reminds the patient, because many times patient forget. It reminds the patient, sir or madam, you're due for your next consultation, next investigation. fixes the appointment, and ensures that the patient stays compliant.
I think this is a beautiful way of engagement, right?
Absolutely.
Instead of doing follow-up calls to ask them to come to hospital or do this test, we have 10%, 20% extra offer, all of those things.
Correct.
I think this is a very, very beautiful use case of how you can actually bring back your customer and make them feel like everything is in place, and it's also adding value to them. Why would they not be your returning patients again?
Correct. So the sustainable way of healthcare marketing is a satisfied patient and a patient that truly holds the perception that their caregiver, be it a doctor, be it a hospital, truly cares for them.
So Apollo being this biggest brand, global network of reputed hospitals, one thing is definitely, the channels are diverse now. The patient is not going to get to know you just by one or two channels, but instead it could be a digital search, it could be through second opinions, it could also be through insurance networks, government bodies, or diaspora communities. So the channels are really vast. So, talk to me about the different channels that from where the patient inflow comes internationally for Apollo.
So broadly, international patients come, I would say, from two major sources. I'll call them as offline source and online source.
Okay.
Right? And there are two levels of proactive efforts that we do as business development teams to solicit patient inquiries from both of these sources. Today, as we speak, in our ecosystem, while digital is rapidly growing incrementally, if you see the year-on-year growth and contribution of digital-driven patient inquiries converted into a patient walking in through the chamber and hence contributing international patient revenue to the organization, generally at an industry level is around 15 to 20%,
Okay.
but it's rapidly growing.
Okay.
So still the contribution of offline business development is still the larger chunk of business contribution. Now, different countries have different norms. So there are specific countries which I could possibly take a few names of. Countries like Oman, countries like Iraq, Mauritius, Kazakhstan, Uzbekistan, Tanzania, Mozambique, and even Maldives in our neighborhood, where you have governmental funding available to seek treatment abroad.
Okay.
Right? Typically, this is funded by either by the Ministry of Health or by the Ministry of Finance.
Okay.
And the way how it works is we as Apollo, we basically showcase or establish our capabilities and credentials of this differentiated clinical services or medical treatments that we offer. And we always keep in mind to focus on those medical treatments that are not available or not easily accessible in that country.
Okay.
Because that the ministry should have a very compelling reason to refer their people abroad.
Right.
For a service that they already have in the country, it really doesn't make sense to refer someone abroad.
Yeah.
So therefore, we only focus on those services, and there are many services that we offer in our ecosystem which are highly differentiated, and that is what impresses upon them. The second thing we look at is affordability. Because every country has a different GDP, every country has a different quantum of funding available for funding treatment abroad, and we need to be very sensitive and cognizant of that. And hence, we have come up with a strategy of differential pricing, which is completely related to the economy of that particular country. So we do a lot of research to look at nominal GDP, per capita income, quantum of funding available per country, basis which we really kind of go ahead and we offer country-specific or region-specific pricing, right? Which is important, and that goes down very well with them. And then Ministry of Health is one source that basically refers patients, and patients come, they get a cashless service from us, and we the hospital gets paid once the patient's treatment is done. That's one. The second one is private insurance. So there are quite a few international companies with good private insurance, Cigna, Bupa, AXA, Jubilee, multiple, good number of them who do fund patients internationally. So the patient would have purchased a medical insurance, and that allows them to seek treatment abroad with a cashless service where we accept the guarantee of payment from the insurance, international insurance. We treat the patient with a cashless service, and once the patient is treated well and the patient is discharged and goes back home to their home country, then the insurance company would settle the bill with the hospital.
Okay.
That's the second one. Then we also have a very strong, I would say, strategic relationship with some of the leading hospitals and medical institutions in different parts of the world. Now, naturally, medical institutions would like to keep patients for which they can offer services that they already have. And again, goes back to the same thing, that for services that they do not have is where they would typically refer patients out. Where what we do is, our approach to the market has been very strategic. We purposely did not want to keep it transactional. Therefore, we get into what is called as capacity building, clinical collaboration partnerships with these hospitals, where we are able to offer skill development, training, type of upskilling opportunities for doctors and paramedical staff of that hospital. We'd like those hospital colleagues to come visit our hospital, meet our doctors, get the confidence that yes, we are able to offer a high quality medical treatment to their patients, basis which they refer patients to us. So this we do in a very, I would say, capacity building type of a format, and not really a transactional format that you just keep referring patients to us. So that's the differential approach that we take. So that's there. And finally, there are basically treating doctors who also get into partnered relationship with Apollo, where as a part of their clinical practice in their private setup, they can refer patients to us as well. And the last part is more of, I would say, a defined commercial part of this industry, where we do have professionally run medical value travel companies and healthcare facilitator companies who basically have access to pools of patients that are looking at treating abroad. And these professional companies facilitate with their visa process, their ticketing process, etc. And they facilitate referral of such patients to our network group of hospitals. And with them we have a commercial understanding. So that's typically how we operate the international patient referral business. Broadly, it is the same for most players in this space.
So you're talking about ministry, you're talking about medical institutions, then there are a few clinicians who are partnering with you as well. So all of this would definitely have a very sizable sales cycle also. For it to reach a deal stage, because there are multiple stakeholders involved and compliances, etc. Especially when you're trying to partner up with another country, so there are going to be layers of compliance strategy to be executed in order to have this up and rolling. What are certain checklists that you follow to ensure that the as much as possible, at the end of the day, B2B enterprise cycle is going to be long. There's no debate about that. But there should definitely be something that you're following to ensure the sales cycle could be potentially reduced, or if we are venturing into it, let's make sure we close it. So there should be certain checklists that you should be following, right? Would you share that with us?
Sure. Typically, from a documentation standpoint, most of the governments or ministries of health or ministries of finance have a very well-defined SOP in terms of documents to be submitted, which we always keep it ready from an Apollo standpoint. And we submit a complete docket, which helps in fast-tracking the, you can say, the review process. The second important thing is to truly understand the constitution of their review panel. Because naturally, on the review panel, you'll have clinicians, you'll have regulators, you'll have financial controllers or compliance officers, you will have certain bureaucrats, etc. So it is important to understand what value are each of these stakeholders seeking before they look at empaneling a new hospital. So we take that effort to try and understand the requirements or try and understand the expectations of each of these stakeholders. Generally, we engage them in medical education programs. We do offer research partnerships because they are looking at partnerships like this. So naturally, as I mentioned to you, capacity building, engagement programs through training initiatives, upskilling initiatives, research programs, academia, publications, medical education programs form different types of initiatives to open the doors to kind of get closer to these stakeholders and try and see how we can meet their expectations sooner. So it does involve, most of this is offline. But what we do see is that, of course, document submission has certainly become online. Agreement processing is completely online these days. Patient data management, which includes patient report processing, patient report review, facilitation of a treatment plan and a cost estimate document, financial due diligence on the cost estimate being given, payments that need to happen post-discharge, all of that has now taken into an online format. To the extent possible, a lot of it has gone the digital way. But I think stakeholder management still requires that personal touch, which is how we are trying to maintain this balance between the offline intervention and the online intervention.
You are dealing with oncology and also biologics and biosimilars, right? So this is a specialty in itself, and also general medicine has a larger awareness, so the conversion could be very easier. But in a specialty, the sales cycle could be a little difficult and also could be complex as well. Because here it's not just going to be a MD or a MBBS, it's going to be oncologist. There could be tumor specialists, etc., etc. So how do you deal conversions for a specialty in healthcare?
It starts with diagnosis,
Hmm.
right? Now, what are the various touch points where we as industry can help with diagnosis itself? Since you spoke oncology, I'll speak about oncology here. There are so many types of cancers that can be detected early with very simple screening tests. Okay, I'll start with oral cancer. There is a very simple test to have early detection of oral cancer. India and many countries where there is a common practice of chewing tobacco, smoking, and multiple types of pan masalas, etc. that people have. So that has a high potential of causing mouth cancer. So there are simple tests which can cause a simple ulcer in the mouth, could very well be screened to check whether it is just a mouth ulcer or is it an early sign of a cancer. So there are tests available to do oral cancer, and these are available at very affordable prices. In fact, oral cancer can be screened at as low as 500 rupees.
Okay.
Yes. Then comes breast cancer. I think the breast cancer is one form of cancer where the awareness is possibly the best. And a simple self-examination of the breast, as we call, is the best way of early detection of breast cancer. And we take a lot of activities, initiatives to educate women on how to do a self-examination and potentially diagnose cancer early.
Right.
Because the faster you diagnose, the earlier you start the treatment, you can in fact cure many of these cancers.
Okay.
The importance is that.
Yeah.
Because the earlier you detect, the chances of getting 100% cure is also the highest.
Yeah.
The later you get diagnosed, the chances of cure also goes down.
Correct.
And hence that's the aim. Once you have diagnosed, you need to do staging, right? In our country, it may not be such a challenge, but there are so many countries where once diagnosed, to stage the cancer properly, you need to do a test called the PET-CT.
Yeah.
Unfortunately, PET-CT is not easily available in many parts of the world. So what we have done is we have come up with easy to access, very affordable programs where somebody can access PET-CT at as low as $550 US. And that package not only has scan included in it, it also includes accommodation, food, airport transfers, all included, more like a medical tourism package.
Okay.
So we provide access to campaigns like that, right? After you get screening done, you get staging done with a PET-CT, then comes treatment. Now, treatment in cancer, cost can be quite variable. As in when you move towards treating patients with more what we today call targeted therapies or immunotherapy, which are now the leading edge of cancer treatment, some of these medicines could be expensive to a common man. Therefore, what pharmaceutical companies have come up with is what is called patient assistance programs, where they have what is called as a 1+1 or a 1+2 patient assistance, where if you were to buy one bottle or one vial of a medicine, the second and third comes free, funded by the pharmaceutical company.
Right.
So therefore, patient assistance program or patient support programs like these are proven to be very beneficial. Why? Because this will enable the patient to complete the full course of treatment.
Okay.
Which, in the absence of which, some patients, due to lack of funding, might have possibly stopped taking treatment because they can no longer afford it.
Right.
After 3 or 4 injections, if they were to stop, then naturally the cancer will progress and they will not get the full benefit of the treatment.
Yeah.
So therefore, these are some of the things, starting with screening, staging, treatment, patient assistance program. Then there are certain organizations who do what is called as deferred health funding.
Okay.
Where in cancer treatment, if it were to cost 40 lakhs or 50 lakh rupees to fund the full treatment, and if some patient does not have access to that full money, there are organizations who offer healthcare funding today, specifically for cancer patients also, including both India-born and certain international organizations, where depending on the cancer patient's profile, you are able to offer them like a loan. where the patient can repay that over a period of time as long as the patient's curative intent and prognosis is proven to be good.
Right.
So these are the various opportunities and options available for cancer patients today, which people need to be made aware of, and they can avail it.
Okay. Sales, like you mentioned, in FMCG or retail is very, promotional based. It could be like offers, very glamorous and cheesy, etc., etc. But it can't be the same way in healthcare. It has to, because there's a lot of clinical and clinical sensitivity and also a lot of emotions involved. So the data that you're getting or using has to be used very responsibly in terms of communications, and also curating all of these programs has to happen with utmost guard. Like you rightly said as well, that you're trying to see how you can provide the best value to the patients. So in a way, they will not find that it's too salesy, but your job also gets done and the patient is also happy. So that's the that's what you're trying to marry here. My question to you is, you're getting all of these data from the patients. How are you responsibly able to use it for engagement or any kind of retention programs or
Absolutely.
in the customer journey?
What is really, really important is to understand how can we as a healthcare service provider, and together with us, say pharmaceuticals, insurance, as a healthcare ecosystem, how can we use patient data responsibly, right? So the first thing that we do is we completely ensure that we honor patient privacy. So naturally, patient data is not shared from the organization to any external body for whatever reason, point one. However, patient data is internally shared with our own CRM team, right? Where the CRM team, in the way that I just explained a little while ago, we are able to specifically take only data points that matter.
Yeah.
So, when is this patient's medication getting over? And can we help replenish that stock? When is this patient due for a next consultation? So can we therefore remind the patient, get them back on time for that consultation? When is this patient due for the next repeat investigation? So can we remind them, fix up an appointment, get them for the consultation? Investigation followed by consultation. So this is how we use. That's number one. Number two, today, internally within our own organization, we have a tech team too, which has developed algorithms. We call it as Apollo Health Access, where we are able to use sequential data of different conditions, be it oncology, cardiology, pediatrics, orthopedics, neurology, etc., where you are able to take sequential data and you are able to now do prognosis assessment. So therefore, it will give you, today you can draw a trend line, like how is the patient's sugar doing? So is it peak and trough, peak and trough, peak and trough, or there has been a consistent control? Why is that important? Because if the patient's sugar were to be peak and trough, it will cause what is called vascular damage, and it can cause the patient to have a stroke or a heart attack or peripheral vascular disease sooner. But if the patient's control were to be more constant and more plateau, the chances of that patient developing a significant vascular event like a heart attack or a stroke is lesser.
Okay.
Now, you need to be able to tell this patient in a certain way which the patient can understand and digest.
Right.
So therefore, we maintain data in a way that we are able to use the patient data to counsel them better. And this counseling is what we call bespoke.
Okay.
It's not one size fits all, right?
Okay,
Because
yeah.
every patient's medical condition is different. In fact, the human body is so complex and so different that no two human bodies respond to the same medicine, the same dose in the same way.
True.
So because each body metabolizes medicines differently, each body responds to treatment differently. So therefore, it is what is called bespoke way of counseling patients, which data helps us do, right? So in a nutshell, data helps us to help patient be more compliant to treatment. Data helps us to remind patients to replenish their medicine stock, come back for periodic consultations as prescribed by the doctor, come back for periodic investigations as prescribed by their treating doctor, and most importantly, though the patient may not realize, if the patient were to just open up the app and look at their trend line, patient will have a self-realization as to how well they have been able to manage their disease.
Right.
And that self-realization is very important, because at the end of the day, it is not just the doctor or a hospital that can help a patient. The patient also has to help himself or herself.
Correct.
Right?
Yeah.
So that partnered way of managing disease can only happen with data.
Right.
So that's how we are able to do it. Of course, there are a lot of takers for anonymized data. And since you asked about data, I wish to bring in specific examples where there are multiple data science opportunities that are possible, in the space of patient data, where you can have anonymized algorithms being built on what could be the right way of clinical decision making. Because we see the role of artificial intelligence emerging to be a great medical assistant to a doctor, where as simple as a drug-drug interaction. The patient could already be taking a certain medicine. Now, if the doctor is prescribing a new medicine, there are two drugs which may not get together so well. So the doctor should know. Sometimes it is possible that the doctor may have missed, or the patient may have forgotten to tell the doctor. But if the algorithm were to pick from past medical history of the patient and throw a red light that, hey, this patient seems to have taken this in the past, please do not prescribe this. That's a great data point for the doctor. It's a caution for the doctor to say, okay, I missed this point. Patient may have missed telling this to me, so I need to be more cautious. What do I prescribe? This is humanly or manually not possible.
Correct.
This needs help of an algorithm, where the algorithm can be a great medical assistant, right? To a doctor to make a data-driven informed decision. So this is, I think, where we are heading. And I think the days in front of us in the near future are very exciting, where we would love to see how AI can truly be that, I would say, how do I say, an inseparable medical assistant to a doctor.
Right. My last question was going to be about the untapped potential of sales with the emerging artificial intelligence. I think you gave me an answer even before I could ask the question. So with that, we come to the end of the main segment. I have a couple of other segments for you, which is the rapid fire and also have you ever. So I'll ask a few questions to you from rapid fire, and I'm expecting quick short answers from you. And if possible, you can make it quirky as well.
Okay, I'll try.
Okay. In the healthcare industry, who's the toughest stakeholder to convince?
The doctor himself.
Oh, really?
Yeah.
I thought you'd say bureaucrats or something like that.
Not really.
Not really?
I think it's us as a system.
Okay. One line on why do you feel doctors are a little difficult to convince?
Naturally, you have different ideologies, different generations of doctors.
Okay.
Of course, we value the experience that they bring in, and there's no replacement to what we call bedside clinic experience.
Correct.
Right? More the number of patients that one has seen, that experience is invaluable. Right? We also need to evolve. I think gone are the days where, of course, bedside knowledge is important, practical knowledge is important, but technology is evolving so fast that with technology, I think access to information is evolving so fast that today we have this so-called thing called Google Doctor.
Yeah.
Right? And I've seen these WhatsApp messages that says, please leave Google outside and come into my chamber. Right? Or there are also some quirky messages I see on WhatsApp that says, if you want my prescription, my consultation is 1,000 rupees. If you want my prescription with Google prescription, it is 3,000 rupees. If you want me to write only what you read on Google, it's going to be 5,000 rupees. So doctors are finding a way to kind of make patients understand that, look, clinical experience is important. Google is good.
Yeah.
Access to information is good, but data should not be misleading.
Correct.
Right? So Google cannot replace a doctor.
Yeah.
Right? Neither can AI.
Yeah.
So I just wish to state this very upfront.
Yeah.
But that being said, I think so, and hence I was just mentioning that, so
doctors are difficult.
Doctors need to embrace technology.
Okay.
Doctors need to embrace data.
Okay.
And doctors need to see AI as a medical assistant and not as a competitor.
Okay.
So that's what.
Okay. Second question. Which matters more in international business, trust or price?
Trust.
Trust. Okay. One line on.
Price can be killed by anybody.
Okay.
Trust cannot be.
Okay. Fair enough. Third question. If you had to bet on one market for explosive healthcare growth in the next decade, which market would it be? Is it? I have a couple of options for you.
Okay.
Africa or Southeast Asia. In case if you have a different ideology on a different country, you can share that as well.
Both are important, but if you ask from an Indian healthcare standpoint, I would still bet on Africa.
Okay.
Yeah.
Okay.
So I think we need to acknowledge that BRICS economies is expanding.
Yeah.
So naturally, Brazil, Russia, India, China, South Africa, these are markets to go. So if you look at Africa as a continent, the two go-to markets of, I would say, advanced healthcare are Egypt and South Africa. But we are proud to say that in India, we have certain treatments, certain technologies which are not available even in Egypt and South Africa, which is where patients do come to us. But of course, patients do look at Indian healthcare as a go-to destination for high-quality treatment at affordable cost.
Correct.
And I think that's the lead we certainly can maintain. The government has taken certain steps about heal in India, heal by India, which is a great step too. I would bet on Africa because Africa is possibly today about 2 decades or 3 decades as to where India was. You know, it's about 20, 30 years ago as to where we were as a country. So they are somewhere there, and they're very quickly emerging. You know, and it's a huge continent. The population is much larger.
Okay.
Whereas Southeast Asia does have certain economies which have very good healthcare.
Right.
So naturally, if we are looking at inbound healthcare, which is more medical tourism in other ways, Africa is certainly a huge market.
Okay.
But I really don't see Southeast Asia as an inbound market.
Okay, got it. Next question is, what's one sales mistake that has zero forgiveness in healthcare?
All right. Having a commercial talk with the patient.
Okay.
Yeah.
Can you give me an example, one example of what a commercial talk? How do you define a commercial talk with a patient?
Oh, I see this every day. There are certain people that say, okay, in this hospital, your medical treatment is costing you 10 lakhs. In this hospital, your medical treatment is costing you 6.5 lakhs. I'm going to take you there.
Okay.
What people don't understand is these two are not the same. If you look a little deeper, the procedure that one does, the qualification of the clinician treating the patient, and the outcome of that treatment matters to a patient. Only if one were to make them open their eyes to understand this and make them understand and make them realize the outcome of what they will be.
Okay.
I'll give you a simple example. Someone comes with a jaw cancer or someone comes with a cancer here in the neck, right? You need to remove cancer, you need to do surgery, right? There is a possibility of doing surgery by just chopping it off and leaving a huge scar here. Would someone like it? I don't know. There is also an opportunity of not just removing it, but doing a plastic reconstruction, a flap reconstruction, and giving an aesthetic good, feel to it, which some people may prefer. There is certainly going to be a cost difference between the two, right? But I haven't seen too many people take that effort to explain outcomes to patients. So that's the biggest mistake. I don't think we should ever have dollar transaction or rupee transaction or whatever, that commercial conversation with patients. Conversations with patients should always be on clinical value and outcome.
Okay. Very well done. We've come to the end of rapid fire. So I think it was very interesting for me to, when I was drafting these questions in my head, I was like, what your answers are going to be. I was really looking forward to it, and it was very good. So,
All right.
So the next segment is Have You Ever segment, and for this I have a few plug cards for you.
Okay.
In case if you have done it, you can show the thumbs up plug card. Okay. If you have not done it, you can show the thumbs down. And in case if you would rather not want to answer, you can show the smiley.
Got it.
The first question is, have you ever seen a therapy get adopted faster than predicted because the sales team executed exceptionally well? Yes. What's the name of the therapy?
It was some years ago. It was a therapy to manage type 2 diabetes called DPP-4 inhibitors.
Okay.
We were fortunate to launch India's first patented drug of those times called Genovia in 2007.
Oh, wow. Okay. So next question is, have you ever seen a breakthrough drug struggle commercially because HCP education wasn't aligned with the sales strategy? Yes. Okay.
Yes. I wouldn't want to name the drug or the company, but yes, there were some great drugs that came both in dyslipidemia management and in blood pressure management, which had great clinical data, fantastic clinical trial, patient outcomes. But at the end of the day, people make all the difference. And the way how you present data with conviction makes the difference. Had they possibly looked at building what is called advocacy cadence, an advisory board where you really pick the top minds, make them a part of a trial, make them to disseminate data and use it in real world patients, I think outcomes could have been much better.
Okay.
So yeah, we lost some good drugs there.
Okay. Last question for Have you ever had a partner in a small country bring in unexpectedly high patient volumes? Yes.
Yes.
Would you want to name the country?
Mauritius.
Oh, really? Okay.
So what's the population of this area where we are, where the office is?
15,000 people are here in the office.
In the office,
Yeah.
but all around this area, maybe? All residences, offices put together, 3 lakhs?
Yeah, easily.
5 lakhs,
Yeah.
maybe? Yes. We are talking of an entire country with 13 lakh population.
Okay.
1.3 million is the population of Mauritius.
Okay.
Right? It does have people of Indian origin, right, who've settled there for many years. They speak French. They have French people. They have just like a 20-minute flight away, they have French Reunion Island, which is still a French colony today with exceptional healthcare, but they still prefer to come to India.
Okay.
Right? So naturally, one would think that when you're building healthcare business, it's important for you to look at countries that have a larger population. Your access to patients is more, but we're so excited to see Mauritius, where with such a small population, there are patients who come in very large numbers seeking medical treatment.
Wow. Okay.
Okay. Fiji, small island, tucked away to the north of New Zealand.
Yeah.
Does have people of Indian origin, right? And it's actually like a 9-hour flight to Singapore and a 2.5-hour flight to Chennai. And we still see patients from Fiji coming to Chennai. So imagine. So yeah.
Okay, so with that, we come to the end of the entire episode. It was such a pleasure to host you. I think your answers were extremely sincere. And what happens in the healthcare industry, especially from the sales angle or a CRM angle, is not something that you get to hear quite a lot. You'll have to read books and you'll have to probably sit down and talk to a professional in person. A lot of talks happens around FMCG, retail, all of that. But this is a very, I think, very one of the gem kind of episode I feel to talk about how healthcare industry functions, and also the sales and CRM strategy behind the operation is truly wonderful. So thank you so much. Thank you.
Thanks for the opportunity, and I truly enjoyed this conversation. Thank you very much.
Thank you.